All right, guys, welcome back to another episode of Nurses Uncorked, the podcast where we pop the cork on stories that no one wants to talk about, but everyone needs to hear. I'm Nurse Erica, a nurse, an advocate, and your no-nonsense guide through the toughest issues facing our profession. I don't sugarcoat it, and I don't hide from threats of retaliation. This week's episode is straight out of the headlines. Real cases, real consequences, and real patients whose lives were impacted. I'm giving you an update on last week's episode, including what happened when I personally showed up to the fake nurse's court hearing. We're also talking about a nurse caught sexually assaulting patients and another case where a nurse whose license is on probation for administering oral medications, IV, yikes. This is a true crime through a nursing lens episode where accountability matters, patient safety comes first, and silence is not an option. Welcome back to Nurses Uncorked. Welcome to Nurses Uncorked, where I pour out the unfiltered truth about healthcare life. I'm your host, Nurse Erica, serving up real talk straight from the front lines to your ears. Each episode, I'm uncorking conversations that matter to nurses everywhere, from the hilarious to the heartbreaking, the inspiring to the infuriating. No filters, just authentic nursing experience shared with a splash of humor and a dose of honesty. So grab your favorite beverage, put your feet up, I know they're tired, and join me as we uncork another episode of Healthcare Reality. Now let's get this shift started. All right, I am joined this week by my good friend, Dr. Matthew Garvey, lots and lots and lots of letters. Welcome back, friend.
It's been so long. I'm so glad to be back. I don't know why you
I
have kept
know.
me in the background for so long, but I'm happy for my return.
You have an open invitation. You can come any week, trust me. And this week was kind of a fluke because I called you for legal clarification questions because you're in law school, and you guys, he'll be the first one to say he's not a lawyer yet, but nonetheless, he's a resource for me. And so in talking to you, I'm like, do you want to just come be on the podcast and lend your endless wisdom and insight? So I kind of corralled you into this sort of.
You did, but I love it. You know I love it. But I will go ahead and give my disclaimer that I'm not an attorney. This is not legal advice. It is from my knowledge, experience, and training only, and training as a nurse, not training as a law student. So
Yes.
not legal advice at all.
But you are a nurse and you can certainly speak to some of this, right? It occurred to me as I was getting ready for the podcast, where were you and I exactly a year ago today?
Oh my gosh. You're going to make my little heart palpitate. We
No,
were in Europe at the European Christmas markets. I think at this time we were probably in Vienna.
I don't know.
We would have been in Austria already.
Yeah, already done
We could
with
have
Germany.
already done with Germany. Yes, we could have been filming our Hallmark movie at this very moment a year ago.
We could have been, just came out like 2 weeks ago. It's a
Is that right?
literal Hallmark Christmas movie that we were extras in multiple scenes, and we made it in the final cut. We
We
did.
did.
And two of the other travelers that were on the trip with us. Yeah, it's amazing. A Keller
Yeah.
Family Christmas. Check it out. It's still showing on Hallmark. What a cool
Yeah, and
experience.
I mean, I really think that 15 seconds that you and I were in are like the 15 seconds that make the entire movie. I mean, let's be
Absolutely.
honest.
Absolutely. Yes. I mean, come on now.
Right, right.
Yeah. I want to ask all the listeners to consider becoming a patron of the podcast. You can do so for as little as, I believe, $5 a month, and it really does go a long way in supporting the podcast. You get early access to episodes and patron-only bonus episodes. Just put one of those out last week, so please consider that. There is a link in the episode description. Let's get into it. Should we do an update first on last week's? I know you really liked last week's episode. You gave me a lot of
Oh,
positive feedback.
yes, I was like enthralled with it. I was driving, I listen as I drive, and at one point I was like, I have to pay attention to the road because I was just so focused on the podcast. I was like, I can't do this. I can't do both at the same time. A great, great episode, but what a crazy story. Like,
Yeah, this
just
is the one about
overall.
a fake nurse practitioner, in fact, here in Las Vegas, who was treating pediatric endocrinology patients. So, like type 1 diabetics and a slew of other endocrine disorders and disease processes that she was treating, and allegedly had no medical experience, certainly no formal degrees, training, anything outside of possibly, which is not confirmed, an army medic in the past. That may have been the extent of it. But yeah, she was caught and fled to Albania right after she got out on bail, and she had her first court hearing this week. So I took my happy ass down there to the courthouse.
Which is where we met. Why do we always have these conversations
Yeah,
around court hearings? We met at a courthouse.
I know. I feel like that sort of was predestined our everything that we kind of interact with moving forward, right? For those that
It
don't
does,
know,
yeah.
Matt and I met at the Redonda Vought trial many years ago now. Yeah.
Yeah. So did she show up? Did she come back from Albania?
She did not, and was not surprised. I mean, I was hoping that maybe she would, but I thought that was pretty unlikely that she would, and she did not. Not only that, but her case was not even called, which was pretty disappointing. Myself and one of the mothers of the children that were treated by her, the one who was a guest on last week's episode, were there in the courtroom listening intently, and they did not call her case at all. We were so confused. And then a bailiff came over, handed us a little piece of paper saying return on, I believe it's February 10th. And we asked, well, what happened? The case wasn't called. And he said that her attorney had already addressed it. So perhaps with the clerk for that judge, but it was not anything official that was said in court. And so I can only assume that they just requested a continuance, and it's been continued until
Maybe
February.
because she's maybe because she's on vacation in
Yeah,
Albania.
on vacation. Uh-huh, in air quotes, in Albania. But this is interesting. I did say in the last episode that there is an extradition treaty between Albania and the United States, but apparently they have a dual criminality clause, which I was not aware of. That my understanding is that that means both countries must recognize the crime. And it might be a little complicated because apparently nurse practitioners are just now becoming a thing there in Albania. So they're not really recognized yet. I don't know if that will play a part in this. I don't know. What do you think?
Yeah, I don't know. I mean, I first of all, I didn't know that. Look at me not knowing the legal side of that. I know.
I knew
And
something
so
you didn't know. I knew
you know a
something
lot
you
of
didn't
things.
know.
You know a lot of things that I don't know. But no, that's intriguing. Listen, and I don't know in the political climate of today what that would look like really, but I would think that because that treaty is so new, right? I think they renewed the treaty that had been
2020.
in place since like 1920s, right? It had been almost in place for like 100 years or something. I may be wrong on
I
that
don't know
date, but
about
it was a
that. I
long
just
time.
saw that we have a treaty from 2020.
Yeah, we updated it, I think. I think we had an original one and we updated it in 2020. And so that's relatively new. So you would think that the two countries would work together closely, seeing that it's a new treaty and not something that we're depending upon, an agreement that was made 50 years ago. But that's interesting. That'll be interesting to see. It'll definitely be a defense for her attorney. I would assume that her attorney is already on that. If they're listening to the podcast, they're
Yeah,
probably at the keyboard right now. They're like,
they
"Oh,
might
Erica
be.
gave us their defense."
Shit. Well, I will be there in February again to see if there's any updates. And I was really disappointed that there weren't any other parents of the victims, of the patients that were treated by her, that showed up. There was just the one, which you won't be surprised if you listen to the last episode, but it just defies explanation to me that none of the other parents are concerned enough to come to court or speak out, allegedly.
Yeah, and I think you and I talked about this. Where that puts me, right, is how broken the healthcare system is. You talk
Yes.
about I don't want to give the previous podcast away because listen, please go listen to it. Phenomenal episode.
Thank you.
But she treated those patients so kindly and with so much
Mhm.
dignity and respect that even though she's facing 70 felony
Over
counts.
70, because now I've seen that there's multiple counts pending in addition to the
Okay.
70.
So even facing over 70 felony counts, indictments, and pending indictments, these parents still felt that she provided care that was superior to what they had received from the legitimate healthcare system. That's what
Yeah.
blows my mind. And that they still feel that because she treated their children so well, that they don't want to
Respectfully.
participate. You know, it's
Yeah.
very interesting. I think it speaks
Yeah.
to how broken our healthcare system is as a whole, just overall in the United States.
Absolutely. Yeah. Well, I will definitely keep everybody updated on that case. Hopefully in February there will be more. Okay. So you may have seen this week in the headlines at UNC Rex Hospital in North Carolina, a male nurse, was terminated and has been charged with, I'm just going to read the list here: first degree kidnapping, sexual assault under the context of medical treatment, second degree forcible sexual offense, and sexual battery. They are saying that he sexually assaulted patients, multiple patients, while they were sedated, presumably in the PACU after surgery, although the unit has not been released yet, to my knowledge. So I'm assuming it was the PACU. He was terminated on November 25th. He had an emergency Board of Nursing licensure suspension on the next day, November 26th. And he was just arrested this week on December 10th. And he is being held without bond at this point. That's a lot.
Interesting fact. This is not the case I thought you were going to talk about.
What did you think I was going to
Well,
talk about?
there's a nurse in Nashville, Tennessee who was just arrested for sexually assaulting a patient.
Okay. Well, we can come back to that one. You're right. And it's a
And
shame that
there,
there's more than one. My
right.
gosh.
And there's a CNA in Kentucky who was just recently arrested and charged with sexually
What?
assaulting multiple patients in a rehab facility who were spine patients, presumably, I guess. I don't know the details of any of that case, but maybe they couldn't feel that they were
Move.
paralyzed. And so I don't know the details of how he sexually assaulted them, but how crazy that we weren't even on the same page, and there are 3 cases, all in the recent past,
Oh
of
my
sexual
God.
assault against patients, which is
That's
disgusting.
horrifying. Well, okay. So have you heard about the one that I started with?
I have not, so fill me in on it.
Okay. So some reports say that he was a travel nurse there. I'm not sure, but he had been employed there since the summer. So earlier this year. He is allegedly a Mexican citizen here on a green card. His name is Brian Alvarez Ortiz. He is facing 13 charges. There has just been a third victim that came forward. The first one alleged that there was inappropriate sexual touching while the Foley catheter was being removed. And then the second patient victim had some sort of a similar allegation. And now we're told, just I believe in the last day or two, that a third victim has come forward. This all just occurred last month in November. His next court hearing is December 1st, and they anticipate that more charges and unfortunately more victims or patients may come forward. And so the local authorities in North Carolina have set up a phone number for people to call if they feel they may have been a victim of his. And I will put that phone number in the show notes for anybody that needs it. Of course, the hospital has put out a statement saying that they, immediately terminated him upon learning about this and that they are outraged. Incidentally, this is the same facility that just about 2 months ago in October, where there was an HIV positive patient who they say purposefully pulled his IV out, aggressively yanked his IV out, and sprayed his HIV positive blood into the eyes of 2 healthcare workers. An unrelated incident, but the same place. So this is just absolutely terrible, right? If what they're
Yeah,
saying is true. I mean, as someone who just went through surgery just 2 months ago, and I can remember my crazy PACU experience, it was nothing bad. I had great care, but yeah, you are so out of it, and time is not what it normally is. I would have thought that I was in PACU for like maybe an hour, and I was there hours and hours. So I can't imagine when you're that vulnerable, being a victim of something from someone that is supposed to be trustworthy and taking care of you. Horrifying.
absolutely. Yeah, and you know what I think is most telling about this incident, just in the brief facts that you gave me there, there are parts of nursing that are incredibly intimate, right? And I think that there are parts of nursing that a patient who maybe doesn't understand the full complexities of what we do could take offense to, right? So if this was one patient stating, "Hey, I felt this was inappropriate," but we're up to three, and there must be a significant amount of evidence to think that there are more because we've opened a hotline, right?
Yeah.
Like, which is what we do for serial killers, right? I mean, you
Right.
open a hotline for people that you think are prolific, that this has happened, multiple times. It's pervasive. There may be more victims who come forward or will want to come forward, maybe victims who thought to themselves, like, this just didn't seem right, but I
Yeah.
was in the PACU, I was under coming out from anesthesia, I'm really not sure. Here's this
Yeah.
story and says, it was my nurse. It was inappropriate. So I think that's incredibly telling that there are already three victims in less than a month who have, came forward to say that they've had this experience.
Yeah.
That's sad.
It is sad. I worry about the way it's gonna be possibly spun if he was a travel nurse and if it's confirmed that he was a Mexican citizen, people are gonna run with that. Yeah, I'll be monitoring this case, and you and I have talked about this. I hate to talk about these cases. I normally do not cover these cases, and then I get inundated with messages from people saying, "Did you hear about this? Why aren't you talking about this?" It's certainly not the first time something like this has happened, unfortunately, but I typically do not cover these cases because the fact is the mainstream media do enough to vilify the nursing profession and nurses at large. I don't want to add to it. I cover important things like violence against nurses and criminal prosecution of nurses and all that stuff. I don't want to highlight the tiny percentage of terrible nurses out there. And so I don't like to talk about these, especially sexual crimes, but ugh. And the fact that there's 3, oh my god, tell us about the other one.
Yeah, so the one in Nashville, I'm just gonna read to you here what has come out about it. It is at Ascension St. Thomas in Nashville, Tennessee. A nurse in Tennessee was arrested after police said he sexually assaulted a patient at a hospital. The police department said that the nurse was taken into custody on Friday just after 9 p.m., and this was published on December 9th. He was charged with kidnapping, sexual battery, prevention of emergency services, and indecent exposure. His bail was set or he was booked into the jail there. His bail was set at 14,000 bond, and his hearing is on February 5th in court. Of course, St. Thomas, which is a huge hospital system in the Nashville area with multiple hospitals, they put out a statement saying, "We are committed to providing a safe, respectful, and trusted environment for our patients, visitors, and associates. Allegations of this nature are treated with the utmost seriousness and sensitivity. The individual is no longer with our organization, and we're fully cooperating with law enforcement as this investigation continues." So, not a lot of information as exactly how the crimes were committed or what the allegations are. I'm sure it's an ongoing investigation, and there are a lot of things they're not wanting to release until that official hearing. Yeah, how crazy is that? And then the
Yeah.
CNA in Lexington
These are
worked
2
at
in your
a
backyard.
yes, one north of me, one south of me.
Oh my gosh.
And this was actually November 18th is when this was released, but it was updated December 10th. There was originally one patient. On December 10th, they updated it and stated two more patients have come forward with sexual assaults allegations against a nurse technician at Cardinal Hill Rehabilitation Center, which is in Lexington, Kentucky. He faces 2 counts of first-degree rape involving patients who were incapable of consent and physically helpless, court records show. According to the criminal complaint, one patient recovering in the spinal care area told police that the gentleman sexually assaulted them during their stay from August 2022 to November 2022. And then the second complaint detailed allegations from another patient who was in spinal recovery from September 2023 to October 2023. The patient also reported being sexually assaulted during their stay. The new charges add to the allegation that was already pending.
Speaking of the case with the CNA, when I was a CNA a million years ago, and I worked agency, so I would be sent all over the city and I did hospitals and nursing homes and everything in between. One time I was out in a long term care facility, if I remember correctly. And there was a patient there, younger female patient, who was pretty immobile, definitely neurologically devastated, unable to communicate or anything, and had been there some years as an inpatient. She was pregnant. Yeah. Yeah.
How,
And when
not how. I don't need to know how. I know how, but who?
yeah, exactly. And I made the same kind of face when I got report and learned. I was confused, like, wait, did she just get here? No, she's been here years. Well, what, who? Well, they did terminate an employee, was what I was told. And I believe it was a male CNA that, yeah. And I don't know what came of it. This was so many years ago, but I just remember being so shocked and appalled, and how horrific. And for the family to know, like, you put your loved one somewhere, you're probably paying a great deal of money and they're supposed to be cared
Yeah.
for, and this happens.
I have lots of questions. Was it consensual? What,
I don't
like,
think so. No. There was no way for
oh,
this person to consent. No.
then that's mortifying.
Absolutely.
This is almost like, you covered the spy cameras in hospital bathrooms.
Yeah.
I feel like violence against healthcare workers, that movement, which should not be a movement,
Mhm.
but has made its way in, as in like sexual perversion in healthcare is like making its way in. The spy cameras in the bathrooms, the sexual assault of patients. And these aren't new, right? I mean, there was allegations against physicians. You can Google this. There are allegations against physicians going back several years,
Yeah.
nurses several years. But it seems that we're seeing it more and more, and maybe it is the mainstream media that they're reporting it more, and they do
Yeah.
tend to grab onto nursing stories because they get clicks and views, and so they grab those
Mhm.
nursing stories and run with them, unfortunately, which, to play the devil's advocate, that may be why we're hearing about it more now. They've recognized that those stories bring viewers, but it's scary. We're still the number one trusted profession, and it's really hard for
Are
me
we though?
sometimes
Are
to
we?
wrap my head around it. This is interesting. The public has this perception of us that I don't know we always rise up to
I mean,
put it
I
politely.
think it's part of a bigger conspiracy plan. People think sometimes I go too far with these, but I really truly believe that early 2020, when we were quote unquote healthcare heroes, and the signs and the pots being banged and all of that, and travel nurses commanding more money than we had ever earned, at that point, the healthcare organizations couldn't do anything because we were healthcare heroes, right? But I really truly believe they played the long game, and we have seen it play out over the last few years, and so a big part of that was them trying to introduce legislation to cap nurses' pay. And then we had the criminal prosecution of nurses. Our good friend Radon Devat became the poster child for that. That didn't exist before we were healthcare heroes in 2020 for all intents and purposes. And then there was suddenly the media constantly reporting on nurses in not just a negative light, but a truly alarming light, with
Right.
one horrible story after the next every single day. And you never used to hear about any of that. And then suddenly every little thing, every little error, every little near miss that a nurse did anywhere in a nursing home, in a hospital, anywhere, was suddenly front page news every single day. And it became this, in my opinion, this long-term plan to vilify nursing in the public's perception of us, because we had been the number one trusted profession for so long. But since then, whether it be COVID deniers, anti-vaxxers, whatever it may be, they just gravitated to that. And now I don't think that we are as trusted as we once were. I think that, unfortunately, a good chunk of the non-medical public out there does not trust us anymore. And I really think this was part of their plan to get us off our pedestal that they couldn't immediately do, and put us in our place, so to speak, and get away with not having to pay us what we deserve, not having to support us because we're these terrible people. Look at all these horrible things that nurses are doing left and right, and you could get even further down that rabbit hole with the whole nursing education system and pushing people out and making it easier to graduate as a nurse, easier to pass the NCLEX. Hell, just take the NCLEX at home. I really think it's part of a bigger long term plan, but that's me on my soapbox and my conspiracy theories.
Yeah, no, but I mean, it does make sense. And the other thing that I think about is how much social media plays into this and
Yeah.
how, you've worked in administration, I've worked in administration. We
Yeah.
both know what that looks like from behind the veil, right? Behind the curtain, the little wizard
Yeah.
behind the
Yeah.
curtain. That curtain has been ripped off.
Yes.
You have hundreds of people reaching out to you a day about things that are happening in healthcare organizations. There are people going to the news media. It also makes me wonder if maybe some of the things that we're seeing is because the public is maybe demanding answers to certain things. And then
Yeah.
also if admin can no longer hide certain things or sweep them under the rug or talk around them
Yes.
because we do have a much more visible presence. I do think that nurses today are more visible than we've ever been, and sometimes that's in a good way, and sometimes that's not in a good way. So that makes me think about that as well. But one thing I think that is interesting that you stated was that the public probably the perception is shifting with nurses being the most trusted profession. What I think is even more damning is to think about that from a nursing perspective. Nurses no longer feel like nursing is one of the most trusted professions.
True.
As nurses on the inside, we're looking at what healthcare looks like today, not just the state of nursing, but healthcare in general. And we're looking back 5, 10 years and we're saying, what happened? How did we get
Yeah.
here? Like, how did we get here? Where did the experience go? Where did the competence go? Where
Yeah.
did the stories of how difficult nursing school was to get through go?
Yeah.
When I went to nursing school, people would talk about the hardest thing I ever did is go to nursing school. And now I think you've talked about, your
Mhm.
daughter's friend who was like, I mean, it's fine. It's not,
Yeah.
it's okay.
Yeah, like, I could work. It was alright. I mean, I wouldn't say it was that hard. Yeah, and I'm hearing that a lot. And
Yeah.
I mean, it really stops me in my tracks because I'm like, "Okay, maybe this is just some one-off, someone who is a genius, whatever." No, we're hearing it a lot that nursing school just isn't as bad as all the hype. Well, it is supposed to
Yeah.
be that bad, and it always was that bad. And I think in some
Mhm.
places it still is that rigorous. But what in the actual, what is going on, that there are programs out there more and more, it would appear, that just aren't even challenging by all accounts. That's
Right.
scary.
Right.
Yeah.
And programs that you can just pay and they give you a nursing certificate.
Yeah. And that
You don't even have to go
nurse
to school.
educators
Just
are
take it.
not allowed to fail nursing students. What?
Yeah, yeah, yeah. We've talked about that because I do teach, as you know, and that's one of the things that I talk to you about a lot is that ethical pull, right? These people have
Yeah.
worked their entire lives, presumably, to get to where they're at in nursing school, and there is this tug where if I fail them, I've ended a career that they've planned to pursue. Some of them their entire lives, and so we look
Yeah.
at things, and we'll get into this with the third story. I think this is a great lead into the third story of,
Yeah.
well, can I remediate or can I do this or can I do that? Or we try to go out of our way to make sure that we help them rather than fail them, which I think has some good components to it. But then that also allows individuals who do not have the capacity to be a nurse, to hold a life in their hands, to administer medications that can start your heart or stop it in a matter of seconds.
Yeah.
We work in such a complex profession and you have to be competent. If you're not competent, patients suffer. And so as an educator, I get that ethical dilemma, right? I'm ruining someone's life and someone's career when I fail them, but then I also am protecting patient outcomes for years to come. And there's that push and pull of, well, you know, who wins out? It's a balancing factor, right? Who wins
Yeah.
out? But I will say there is a shift in nursing education and education as a whole for retention. And how do you improve retention rates? You pass people. So I do think we're moving from that. Even as a society, though, everyone gets a trophy these days. I did not
Yeah.
get a
That's
trophy
true.
when I was a
I did
when I
not.
was a kid.
No.
My mother was
No.
a sports fanatic, and my little chubby self was not great at sports. And I can tell you that she did not give me any trophy that I did not deserve.
And
You
nursing
know,
school is not supposed to give you a trophy for
they
showing
are
up.
not. They are not.
Yeah.
And it's not a sport everyone should play. It's not a
No.
sport that just anyone can jump on and say, oh, "Okay, I'll be a nurse today."
Yeah.
That's not how it works. So,
Yeah. Well, that is a good lead in to our third story. This has to do with an RN in California named Erica, unfortunately. And remind me to come back to the name because I found something when I was researching this.
okay.
But I'm just going to read a little portion of this that I think gives a good overview of it. And this is from the legal court documents. Buckle up, guys, because this is a lot. In an interview with facility staff, respondent stated that she attempted to administer the medication orally after she crushed the medication with a syringe and mixed it in milk. Respondent admitted that she learned this procedure after she watched a TikTok video and not in nursing school and or from education through the facility. She further stated that when the patient was unable to swallow the medication, she connected the syringe to the intravenous line and attempted to push the crushed oral medications into the IV. Respondent stated that the IV appeared infiltrated and she was unable to push the medication. However, she then flushed the line with saline. Shortly after this, the patient went into cardiac arrest and the patient died on March 2nd, 2024. That is hard to even imagine at all. The medications, for anyone that's curious, were trazodone, melatonin, Lipitor, and Ativan. So 3 of those were oral. 1 was IV. This occurred at St. Bernardine Medical Center in March of 2024. It was a 66-year-old female patient. This nurse has a BSN degree from 2023. So this was about a year after she graduated, which was, post COVID in that time frame. And I found it confusing because when you read through the court documents, this is one of the reasons I reached out to Matt, was because it said that the Board of Nursing revoked her license. But then it goes on to say that they have stayed the revocation and she is on 3 years of probation, which seems to be contradictory to me. But can you explain that? What you think it may have been?
Yeah, so the way it's written is odd, right? First of all, this was a settlement agreement. So I think that that's something that we need to just throw
Yeah.
out there is that she settled this. It was official board action, but it was a settlement. Think of it as in a plea deal in a criminal case. This was essentially a plea deal of the administrative law case, right? She
Okay.
agreed to this probationary period. And so without like a formal, necessarily without
Hearing.
a formal hearing and judicial action, that kind of a thing. A judge didn't order this. The nurse and the board of nursing came to this agreement on their own terms. But what that looks like is what that tells me is that essentially the board is saying this conduct is deserving of revocation, of us taking away your nursing license. But we're going to stay that, which essentially a stay is just a suspension in legal terms. We're going to suspend that revocation and put you on a probation for 3 years. And then they go on to explain, which I'm sure we'll talk about, several of the things that she has to comply with in that probationary period. If during that probationary period she violates any of those things that she agreed to in that quote plea deal, unquote, that settlement offer, then that revocation is enacted. Right, then she will lose her license.
Yeah.
So it's hard to think of it in the legal world. It sounds odd because in the layperson or in the civilian world, we would just call that probation, right? If you
Right.
violate your probationary period, we're taking away your license. So
Yeah.
that's essentially the legal terminology for that is this conduct was sufficient to revoke your license. However, we're going to stay that. We're going to suspend that revocation, allow you to keep your license in this limited capacity, and you can practice within the constraints of this agreement.
Yeah. And then it was even more confusing to me anyway, because it again seems to contradict itself, some of the verbiage about saying that, okay, you're on probation, you should not have any direct patient contact, But at the same time, we are requiring you to work a minimum of 24 hours a week as an RN. Can you speak to that? What your
Yeah, so I
interpretation of that was as a non-attorney?
right, as a non I'm because I'm not an attorney. Gosh, I have 2 years left. Help me. Pray for me if you're listening. But, what I think that they're wanting to do there is to maintain some sort of minimal competence and some sort of active practice of the license. For example, I live in Kentucky, in the state of Kentucky, to be a nursing assistant. And there may even be a law like this for nursing, but I don't think there is. But to be a nursing assistant, you have to practice, for example, 8 hours, one shift in a recertification period in order to recertify. Essentially, just to prove that you're keeping the license active. Right. So I think that they want her to continue to work and utilize her license since they're allowing her to keep it, as one of the things that they're wanting her to do. But they want her to not touch patients. So a non-bedside role. So like utilization management, a transfer center coordinator, patient logistics, bed placement. A lot of facilities will use registered nurses for those roles. But yes, so they want her to continue to actively use the license, just not at the patient's bedside. One of the things I think is interesting about that is that's hard, right? For nurses who are trying to get away from the bedside, they will tell you finding remote
Yeah,
work that's not patient facing is not easy.
not
It's not an
easy.
easy task.
Everybody wants it.
So, yeah, and so I think that one of the interesting things is they acknowledge that in the settlement offer and say, essentially, if you're looking in good faith and you can't find anything, we will make an exception for that, but we're going to extend your probationary period
Yeah.
if you can't do that. So I found it interesting. Again, just the way they say it, attorneys, they don't say things in the most plain language where anyone can understand it. And so, yeah, that's I think they just wanted to keep her license active. They wanted to continue to
Okay.
use it, just not at the bedside, not patient facing.
What are some of the requirements that she has to do to successfully complete her probation? I know there was an educational requirement. Did you read through some of that?
I did, which was incredibly vague.
Yeah.
The educational requirement just said to do essentially a nursing course. Well, I don't know what that means. That the board has to approve. So I guess she can. This is speculation and me being a little bit sarcastic here. She can go online and find any old nursing course and submit it. And if the board approves it, she can take it. Right. There was
Yeah.
no. What I noted about that was there was no requirement, as in how many CNEs it had to
Right.
the length of it. This was a medication error. There was
A
nothing.
major medication error.
Right. There was nothing in there that stated she had to do any type of medication safety training. It just
You
said a
would think.
nursing course, you know?
Right.
And so I would have liked to have seen some more strict language around what that education course would consist of. And as we all know, the Board of Nursing is really there to protect the public. I think the public would have also liked to have known that. Well, what exactly are you requiring her to do? What kind of
Yeah.
education? Because if she's doing pediatric head trauma training, that does not equate to her
Right.
major medication error. So what kind of
Yeah.
remediation are you doing? One of the things I thought, oh, this lawyer's kind of savvy who wrote this up, which was an assistant district attorney, is he talked about practicing outside the state, right? Did you
Yeah,
read
I
that in
was a
there?
little I did, but I was a little confused on that as well.
Yeah, so they use the word toll, which in the legal sense, that just means to stretch it out. Like time pauses, essentially. If you're going to toll something, time pauses and then restarts at a certain point. So
Okay.
it said in there, that that the nurse is required to tell them what states that she is practicing in. She's required to tell them what state she holds another license in. Presumably, they could get all of that because that's all public record, but she's required to tell them as well. Required to tell them within like 72 hours of any position change, right? Of getting hired or of getting fired or separating employment in writing. But if she should practice nursing outside the state of California, then the time frame is told, meaning first of all, she has to ask permission for it, but that will not count toward her 6 months of working 24 hours a week requirement
Okay.
that's required in California. So she can go work somewhere else for 10 years. It doesn't matter. She still has to come back to California and fulfill the requirements of that obligation, which is to work 24
Gotcha.
hours a week in an RN role in a non patient facing position for 6 months. That is what she agreed to. It's a contractual agreement. So
Okay.
even if she goes and works in another state, does whatever, which I doubt she would because, this is public. I mean, you found it on the
Oh,
internet. I mean, right?
Yeah, but listen,
It's out
her
there.
social media is all I because I did a deep dive.
Oh,
Tell
I'm
me
sure.
why her
Yeah.
social media is public and it's all about nursing and proud BSN and so happy to be a nurse and her LinkedIn and is listed as on the board of directors for National University Student Nurses Association. It's just I don't know. I think if that was me, I would be under a rock somewhere trying to
Yeah.
hide and not having everything public. I mean, that's a
Yeah.
massive med error and lapse in
It
judgment.
is massive. 100%. Uh, no, I agree. And if I can see both sides from a legal perspective. Again, not an attorney, but thinking through what I would if it was me, right, who had this, God forbid, let me knock on wood, ever had a medication error of this magnitude, I would immediately think I need to delete all my social media.
Right.
I need to not necessarily go into hiding, but I need to become a blank slate in the eyes
Yes.
of any of the media. Everything can be used against you. I mean, you could
Yeah.
access all of that information in an hour. You could have all this information. So could the Board of Nursing. So could
Mhm.
this patient's
Yeah.
family, should they file a civil lawsuit for monetary
Right.
damages?
Yeah.
All of that is readily available. So I would have immediately taken down everything and essentially became a ghost
Me too.
online. And that the fact that her attorney didn't tell her that is, or maybe he did, I don't
Yeah.
know, but I would expect the attorney to say that. Maybe the attorney said maybe it's a defense strategy to celebrate yourself as a nurse and project this
Oh my gosh.
confident
Maybe.
facade. I don't know. I don't think that's a great tactic.
No. Yeah. I haven't seen anything reported about a civil lawsuit. I mean, I'd be surprised if there wasn't one, but I haven't seen anything about that, nor have I seen anything about criminal charges. And I will say, if you follow me, you know that I am adamantly against the criminal prosecution of nurses, right? And so I would not think that that should have happened in this situation. But you and I did have a difference of opinion on what the Board of Nursing action should have been. Because when I first read license revoked, I thought, yeah, that's appropriate. You pushed crushed oral meds IV. Like, that's beyond comprehension. You should lose your license. But you said what? What was your opinion?
I feel like I'm going to get read for filth on this in the comments. I would not have revoked her license. I would have actually taken very similar action to the California Board of Nursing. I there's a couple things here. First, I think any situation where a nurse has committed an error, we have to consider the contextual factors that contributed to that error. And that's often far beyond the immediate factors that affected it, such as staffing, patient acuity level, patient load, what was the nurse to patient ratio, were you precepting? That was a fact in Redonda's case. She had a
Uh-huh.
student with her, so she was distracted? Was there system downtime? But aside from all of those factors, this nurse graduated in 2023, I think, according to your research.
Yeah.
So that would mean she went to school during the COVID pandemic, where many students didn't touch patients. They played a video game, right? They
Yep.
played a simulation of how to take care of patients. And then, you and I've talked about this. You love my phrase, the phenomenon of diminishing experience. And so
It's
it's
brilliant, and I'm still waiting for you to write a book about this. You need to coin that term. Explain what that is a little bit. Phenomenon of diminishing experience is the perfect way to title this.
Yeah. And this kind of speaks back to the fact that nurses no longer feel that nurses are the most trusted profession. So for many, many years, especially for the baby boomers, we had very experienced nurses at the bedside. When I graduated nursing school in 2024, started practicing in 2025, the nurses who precepted me had been nurses for 20
You
plus
didn't
years.
graduate in
I
2024.
mean, 2015. Look, I don't even know what year it is. 2015. I graduated in 2014, started practicing in 2015. And my nursing and preceptors at the bedside had been nurses for 20, some 30 plus years.
Me too.
These
Yeah.
were incredibly experienced nurses. Yes, they ate their young. Okay. That
Yeah.
was a cultural issue and it should not have been that way. It should have been empowering. But I will tell you this, it made me a much stronger nurse, for one.
Agreed.
And then
Agreed.
I had experience. If I had a question, I could turn back to that preceptor, ask the question, and know that the wisdom I was getting in return was just that. It was backed with 30 years of experience and competence. when COVID happened and we looked at those nurses who were in their 60s, 70s, some
Mhm.
of them who had been practicing for 30 plus years, and they were doing it because they wanted to be a nurse, not because they had to be. They could retire at any
Mhm.
given time. And we said, here, wear this trash bag
Yeah.
or wear this N95 for 5 weeks straight. And it's going to clean itself when you put it in this lunch bag.
In this magical bag.
Yeah. Shake it up, put it in that bag and shake it up, and you're going to pull out say abracadabra when you reach in, and when you pull it out, it's going to be brand new. Um,
But
when we
wait, no.
told these
My
nurses,
favorite was when you didn't even get your own mask back and they all
oh
went
yeah,
into a communal thing, and then you were
yes,
expected to believe that it was clean and you were using someone else's oh my god. I can't
yeah,
believe we did that.
and you put it back on your face, and you could smell their breath because it was so clean.
Yeah.
Um,
Yeah.
And then, these nurses that had been here at the bedside for so long said, screw this. I've given my
I
life for this
know.
profession, and I will lay down before I die for this profession. Right.
Mhm.
They kind of had that mentality of like, I do not have to do this, and I'm not going to. And then some of them rightfully so out of fear. We know that COVID was disproportionately killing older individuals. And so some of them said, I'm not going to put my health at risk. I have kids, I have grandkids. So they left. So what was left at the bedside?
New
Brand new
grads.
graduates, brand new grads. What wasn't new graduates, those 5 tenure nurses, all were trying to seek either provider level roles or non patient facing roles, right? They
Yeah.
were trying to get away from the bedside because they knew the hell that they were living in. And they're like, we're not doing this either. So it left all new graduates. So when you look at what happened during the COVID pandemic and what has happened since, I don't know with this nurse, right? This is only speculation. I have no clue the nursing school that this nurse went to, but let's just use her as an example. She went through nursing school during COVID. She potentially did not touch patients, or at least minimally touched patients. The majority of her clinicals in that time period were completed as a simulation game on a computer. Is that wrong? It depends on whose perspective you're looking at. It was the COVID
Yeah.
pandemic and the world looked very different. Okay. But what did we do in healthcare in response? Nothing, right? They
Yeah.
graduated. We put them in the exact same residencies that we put students who had had quality education in pre-pandemic.
Well,
We
and not
didn't
even
we
because we cut them short.
Yeah. And then we didn't even we made no changes to our residency programs to assist the COVID generation of nurses who played video games as their clinicals to acclimate to bedside practice, right?
Yeah.
Then we put them in orientation and we gave them a preceptor. But remember, I just said all of our experienced preceptors, they're out. They're not wearing trash bags.
Yep.
So now you have a new graduate being precepted by a nurse who potentially has a year experience themselves. They don't even know how to
Blind
fully
leading the
practice nursing,
blind.
right? Then we were short staffed and travel pay was so expensive. So hospitals were doing everything they could. So you had essentially a new graduate training a new graduate. And then if that preceptor said, hey, Erica, Matt's doing really good. Instead of a 6-month orientation, we dropped it to 3 months. And then if they were
Yeah.
even doing exceedingly well, we dropped it to 6 weeks. And we said,
Yeah.
here's a COVID patient that's ventilated and prone and
Figure it out.
paralyzed, and you've got this.
Yeah. You're doing so good. We're
What?
so proud of you. We think that you're doing so amazing that you're ready and we can take you off
Yes.
orientate. Good job. Good job.
Yes.
Yeah. They
And by the way,
gaslit the
we
hell
need a
out of
charge
them.
nurse. We also need a
Yeah.
charge nurse. Can you fill in for that role while you're at it? So we saw this diminishing experience, and diminishing may even not be the right word because it was vanishing. It was
Yeah.
overnight that we went from a competent, experienced workforce to a workforce with probably cumulative less than 5 years of experience, right? If
Yeah.
you were to average it out, which is scary as hell,
Mm-hmm.
right?
Yeah.
We see that as experienced nurses ourselves. We look at that, and again, that's why I say nurses feel that nursing is no longer the most trusted profession. We saw that wisdom, that knowledge, that competence walk out the door. And so when I look at this case, right, and I think about all of the contextual factors that potentially contributed to this nurse's negligence in this given scenario, does it, as a nurse for 11 years, have been in healthcare since I was 15. Does it sound absolutely egregious to me? Yes. And it is, right? It is.
Yeah, it is.
Would it sound that way, though, to another nurse who was a year's experience and graduated during the pandemic?
I
Maybe
think so.
not.
Yes.
I would hope so. Maybe not. And so, I do think that I would have, this is where you and I disagreed. I would have remediated. Now, I would have, and maybe the
Yeah,
Board of Nursing has more of a remediation plan that wasn't explicitly listed within the settlement agreement,
maybe.
but it's not posted. So we don't know, right? I would have liked to have seen a more detailed remediation plan in the settlement, just so
And
that
also, we don't know, I'm sorry to cut you off. We don't know,
no,
did
you're fine.
she self-report this? That is not specified anywhere.
Correct.
So we
Mhm.
are maybe assuming that she did, which I do think should be taken into consideration when you're considering
100%.
board of nursing disciplinary. Like if you hid this, if you covered it up, which who would blame you in this day and age? But that should be taken into account. You report it, you do the right thing. Okay. Well, let's practice just culture.
Yeah. Yeah. So it's hard, right? It's really difficult in those situations to say, yeah, I'm going to take your license. You made one mistake. And I said this during Redonda's trial. Nurses are not infallible. We're human beings. Now, this was an egregious mistake. And this was
Yeah.
a mistake of just gross incompetence. Okay, let's call it like it is.
Gross gross negligence.
You
Gross.
know, right? You should know. God forbid, you should know. You cannot crush oral medicines and push them through an IV. Okay, we can't do that. That's just incompetence. However, if I pull through a fast food restaurant and I'm allergic to pickles and I say I want a burger with no pickles on it, right? And you by accident don't on my little order slip, you don't see it says no pickles, you put pickles on my burger, I don't pay attention, I bite into it, I have an anaphylactic reaction and I die. Do we tell the person who is a professional burger maker that they can no longer make burgers for the rest of their life?
Yeah.
Right? And that sounds like a
Yeah.
very simple, right? Because nursing is highly complex. We're highly educated professionals, right? And equating it to that
Well, we
role
used to
seems
be.
somewhat right, right. Well, actually, I think the government didn't I see this that Congress just protected us, that they
How?
introduced a bill to make us professionals again.
Did they?
I think so. Anyway, we're getting off topic,
Really?
but back to this.
Okay.
I think they did.
Okay.
We'll have to look that up. Eric will do a patrons only bonus episode for you all about that.
No pressure. Become a patron. Become a patron.
Correct.
Become a patron.
Correct. But I think that, it really speaks volumes to say that nurses can't make mistakes. We can. We are human
Yeah.
beings.
I agree.
Every profession known to man makes mistakes. What I think is the thing here that makes it look more egregious is that when we make mistakes, sometimes it results in a patient's death.
Yeah.
And most professions do not have that level of responsibility or carry that level of liability.
True.
And so I'm not diminishing the death. It's horrific. I'm not diminishing the death at all. But what I try to do when I look at these scenarios is remove the death from it and look at it objectively and in the contextual framework, right? What led to this error? And was it truly intentional? Was it grossly negligent? Was it
Yeah.
reckless? And then how can we mitigate it from happening again?
I
And
don't think
all
it
of that
was
just speaks to a just
intentional.
culture.
I just can't, for the life of me, wrap my head around. You pushed, you knew they were oral meds. You
Yeah.
crushed them and you attempted to give them orally. And
hmm
you thought you could push that into what? The
Well,
level of ignorance, incompetence. I cannot. I probably would have revoked her license. If it
yeah.
were up to me.
But you know what's crazy, like we talked about with the sexual harassment, this is not the first case of oral medications being crushed
It's not
and
even the second
dissolved.
case.
Correct. So that makes you think, is this pervasive? What if it's not just a single issue, is it a nursing school issue? And then, you
Yeah.
and I have talked about this. You've said in many podcasts, you've said it to me, when do we hold educators responsible? Okay, as an educator, that
Yes.
makes me like cringe. But I'm like, oh, I'm so liable in every other aspect. Why do I have to be liable there too?
Yeah.
But it would be almost impossible because to prove that would be very, very difficult, right? Because these nursing schools are always going to have a syllabus. They're always going to have a textbook that said that you cannot push oral medications IV. They're going to
Right.
be able to defend that. However, if you start seeing these patterns emerge, nurses all across the United States who are crushing medications and dissolving them and pushing them through an IV, because it's not just localized to California. At what
No.
point do boards of nursing, coming back to the board, who grants nursing schools their ability to practice, right? Who grants them their authority to be a nursing school? At what point do they step in and say, "Hey guys, this is an issue,
Yeah.
like National Council of State Boards of Nursing, okay?
Yeah.
This is a national issue. We have to address this. What is happening? Why do we have nurses in multiple jurisdictions across the United States who think this is okay,
Yeah.
right? And so again, that's another factor that I consider. You may have revoked your license. I do think it is something that most people would say revoke their license for. In my mind, considering those contextual factors and considering that it's, I don't want to say pervasive, but it's definitely widespread, right? It's not located to just the West Coast or the East Coast or the South.
No.
It's
There was
it's
one in
widespread.
Tennessee in 2020,
Yeah,
also during COVID. There was another one I reported on also during early COVID. I don't remember what state, but that's 3 off the top that I'm aware
yeah,
of. And the one in Tennessee in 2020, I thought was interesting because the legal argument, the nurses' attorney's argument, was that they claimed that the nurse and the facility would be legally protected, kind of bulletproof from any liability under the Federal Emergency COVID Pandemic Act, which I think is very interesting. But yeah, I'd be curious, were all these during COVID? Were there cases before COVID? I feel like the
right.
majority, at least, are probably during COVID.
Yeah, or during the COVID educational years, right? Like this nurse was 2023, the pandemic would have been technically over.
Well, and I think
But
that she may have graduated end of 22 and then passed her boards early 2023. So, I mean, that
okay,
means 2020 to 2022 would have
she was in
been
school.
her nursing program.
Yeah.
So,
Yeah,
yeah, that
so
fits right in there.
yeah, it does. It's scary. I have a family member right now who's in the ICU, or a close family friend of mine who's like a family member. And they called me today and said, "Do you think it's, we're exhausted. We've been sitting at her bedside. Do you think it's okay if we don't go today?" And as a nurse, I said to them, the number one way to make sure that she gets the care that she deserves is to be present. If you're not
Yeah,
present, I don't want to say the word neglect because that carries legal ramifications, but it's much easier to pay less attention to someone who doesn't have family sitting at their bedside. I know you're exhausted, but someone
yeah,
needs to go at least show face for a certain period of time to ensure that she gets the care that she needs.
I agree.
And that's sad, Erica. That's sad that we're there as
Well,
a
it's
profession.
it's terrifying. It's
Yeah,
scary.
absolutely.
Yeah.
Absolutely.
I just
But,
don't know
I
how
do
how
think
we are at a point where we are graduating nursing students that have somehow missed the part where you can't give oral meds IV.
I know. It's insane. It's insane. And I do think that a lot of it comes into the academic sector and then also in back on the healthcare system, right? The hospital organizations themselves that essentially turned a blind eye to what was happening on the academic side of things and
Yeah,
didn't necessarily respond and assist these nurses in acclimating to practice. And unfortunately, when you create these egregious mistakes like this, it's not the hospital's nursing license, it's
true.
yours. And so, um, I think it's hard. It's hard because it puts the nurse in a very precarious situation of
Yeah,
sometimes even I didn't even know this. I didn't know. No one had ever told me, or maybe just I'm going to use that defense whenever there was definitely more factors at play. So
well, in this
I
case,
applaud the California Board of Nursing because I would have done the same thing. I would have not revoked her license. Um,
okay,
Erica would
okay.
have said, "Girl, you killed someone and you pushed oral medicines through an IV and you can't be practicing nursing."
You're not, I would have said you're not safe. I
Yeah.
applaud you for coming forward if in fact she self-reported it. We don't know for sure. I applaud you for that. Thank you for doing the right thing. I recognize that you're remorseful, I assume, but you're not safe. You're not safe.
Yeah.
I mean, that would have been my thought. I don't know. You're a nicer person than me. In this case, the hospital did terminate her and she
Mhm.
hired an attorney. And like you said, she has an agreement,
Yeah, settlement agreement.
a settlement
Yeah.
agreement. And upon successful completion of the probation, her license will be fully restored and she will be presumably allowed to practice, unchecked. And yeah, not the only case. And it's alarming, concerning. So I don't know what the
It is.
takeaway is, but I did want to share something that I thought was funny in researching this because I just put in her full name, which I've purposely not shared because that's not my goal to,
Right.
out anybody. But I put in, nurse and Erica and her name. And guess what came up?
I can only imagine. Tell me.
Who is Nurse Erica was one of the very first things. So, of course, I had to read it. Did you know that there's an AI overview of me? I did not know this until today. Would you
Oh,
like to hear it?
of course I want to hear it. I may have things to add. I think I know her. better than AI. Let's see.
You might. Okay. It said, Nurse Erica is a prominent, outspoken registered nurse and healthcare advocate known for her raw, honest insights into the nursing profession, tackling issues like workplace safety, safe staffing, and ending nurse martyrdom, and using social media, TikTok and Instagram, and platforms like her podcast, Nurses Uncorked, to empower nurses and drive systemic change. She's a respected influencer, has founded advocacy groups, advises nurses on their rights and well-being, drawing from extensive clinical experience in pediatrics, hospice, and leadership. She focuses on improving conditions, safety, and fair treatment for nurses, fighting against burnout and toxic environments, uses platforms to share unfiltered truths, connecting with thousands of nurses a day, a movement builder, co-founded the Red and Black Ribbon Campaign, the Last Pizza Party. Ooh. Goal is to empower nurses to advocate for themselves and change the profession from within, ending the damaging martyrdom mentality. In essence, she's a modern voice in nursing, blending real-world experience with activism to create a better future for healthcare professionals. And I
That
was
sounds
pleasantly
amazing.
surprised.
Send that to every speaking engagement you have this point forward. That's your
Right?
bio.
I was
There's one thing
nervous
they
when
left
I
out.
first saw it. I thought, oh God, it's going to be something terrible because I feel like there's always something terrible when it's about me. But that was actually really nice. I was pleasantly
It was.
surprised.
What's the one thing they left out? Let me see if you picked up on it. There's one thing they
I
left
don't
out.
know. What is it?
There's nothing about union advocacy in there.
You're right. I thought you were going to say something about me having an intolerance to cold or something.
No. Although you do have an intolerance to cold.
I do. You're
Yeah,
right. There
that
was
is
nothing
real.
about union activity. That's true.
Yeah, that's the only thing that I
Good
was like, I
catch.
was waiting for it to be like, she's a strong advocate for unions in nursing or unions in healthcare and has a growing daily disdain for scab nurses. And no,
This is
I
true.
was like,
This
I
is
didn't
true.
expect it. I didn't see any of that. I expected it and didn't see it. So
Yeah.
that's awesome.
Now for your Enema of the Week.
This week's Enema of the Week award is brought to you as always by Happy Bum Co., a leader in at-home enema solutions. All right, the holiday season is basically a marathon of cheese boards, cookies, and cocktails, and just one more plate. And while your heart may be full, is your gut doing okay? Yeah, not always feeling the same joy, right? That's where Happy Bum Co. comes in. Happy Bum Co. makes at-home enemas that are simple, gentle, and designed to help you feel lighter, less bloated, and way more comfortable after all that celebrating. Whether it's post-holiday meals, vacation indulgence, or just getting back on track after a long stretch of comfort food, Happy Bum Co. helps you reset without awkward appointments or complicated routines. Everything is discreet, easy to use, and made with your comfort in mind. Think of it as a little self-care for your digestive system, because honestly, it has been working overtime. If you're ready to feel like yourself again, head to the link in this episode description or go to happybumco.com, and don't forget to use code Nurses Uncorked to save 15% off your first bundle. Celebrate hard, reset smart. That's Happy Bum Co. All right. This week's Enema of the Week award is just a personal beef that I have lately with kind of the Christmas holiday industry out there that I feel like are working against me this year. I don't know why, but it's a three-pronged beef that I have. Okay. One is you may have heard me complain about Christmas tree lots apparently not being willing to put trees on top of your car anymore for liability reasons after 30 years of them always. What? The other one is companies that want to charge you over $2,000 to hang Christmas lights on my small one-story house. The audacity. And then the other part is, can we please stop, for the love of God, making tree ornaments that are so heavy you can only put them on fake trees? And if you dare put them on even the biggest branch on a real tree, it drops and shatters because it weighs 10 pounds? Can we please stop doing that? That's it. That's my rant.
Do you want sympathy from me? Your listeners don't know that I'm your most unsympathetic friend.
You guys, he is so unsympathetic. You have no idea. I call him after my doctor's appointments when I still have a seroma from my surgery, and they have to go in and try to aspirate it with a giant gauge needle. And he's like, yeah, okay. Anyway, let me tell you about this other thing. He gives zero fucks, no sympathy.
I do care. I do care. I'm a nurse. Call an elementary school teacher. They'll care. I'm a nurse, okay? I've seen way worse.
I know.
It is
I'm the
funny though,
same
you
way.
all. She calls me and she'll tell me a story, and then I won't even have time to respond. She'll end it with, and then they took an 18 gauge needle and they shoved it in there, and then they did this. And I know you have absolutely no sympathies. How was your day? She
It's
doesn't,
true.
she doesn't even give me time to respond now. I just don't have to do
It's true.
anything. I just listen.
But I was
Pretty
surprised when I
funny.
was complaining to you about not putting the Christmas trees on top of the car. You said that no one where you live gets real trees. They don't even have Christmas tree lots near you.
No.
What?
So, I mean, in the bigger city, maybe I live in the middle of nowhere. And so we
Okay.
definitely do not, if we get real Christmas trees, we go to the farm and cut them ourselves. And so we don't have a thing like a Christmas tree lot. But I would say 98% of people in my hometown have fake Christmas trees. And even in the larger cities around me, real trees aren't typical. They're not a thing. We have some lots, but they're skimpy. There's maybe one or two. Real trees just aren't a thing here. I'm not sure
I
why.
understand it's becoming less and less common and it's probably better for the environment and all that. And it's so easy with the fake tree. Like, I get the convenience of it is so nice. You can put it up the day before Thanksgiving. You don't have to worry about it dying. You don't have to go out and get it, haul it in. It doesn't make a mess. And I get the lure of it. But there's something about a real tree that is just, you can't match it with a fake tree. It's so nice. And so I think I'll always be a real tree girly, but I don't know what I'm going to do if this becomes a trend and no one will put it on top of your car because that's a problem. And I know I sound entitled, but really 30 years and I've never run into that. And suddenly they're
Yeah.
looking at me like I'm crazy when I'm surprised. So, and also after I posted about that, I felt really bad because people were DMing me saying, well, this is because of what was it, Hurricane Helene in, I think,
Yeah. In
North
North
Carolina.
Carolina.
Apparently, all of the Christmas, like 80% of the Christmas tree farms are in North Carolina. I did not know that. And so
I had no clue.
this is the result of that. I had no idea. So I guess there is a Christmas tree shortage and there's a legit reason. Didn't know that. And none of the 4 places that I went to mentioned it.
Yeah, I didn't. I had no clue. And I'm close to North Carolina. I mean, it's not too far from me. It's driving distance, and I didn't know that
Yeah,
they were like the Christmas tree growing capital of the world. I had
I
no
had
clue.
no idea. I had no idea.
So,
Anyway, tell everybody where they can find you and if they need to utilize maybe some legal nurse consulting services or pick your mind for consultations, all that good stuff.
yeah. So on social media, it's my personal social media everywhere, right? Except for TikTok. But on social media, it's Matthew Paul Garvey everywhere. That's my whole legal name, right? I could never do anything. Everybody would find it. And then my website is www period Garvey GarveyCES.com. So Garvey Consulting and Education Services. And then on TikTok, Scrubs to Suits RN. But 2026, the goal is to be more active on social media because I have so much free time between
Yeah, with law school and working full time and everything
owning a legal
else.
nurse consulting company,
Yeah.
teaching.
Writing a blog, a very successful blog, y'all. He's out there just disrupting the legal nurse consultant world. And I
I
am
am.
loving every minute of it.
I am. That's why Erica and I are friends. We're both productive disruptors.
That's right. I love that. We need a
Yes,
shirt.
I do too. We do. We do need a shirt. People call me other words. Productive disruptor is what I refer to myself as, but people have
Me too.
other nice, colorful names that they call me.
Same. Same.
Yeah,
Well, thank you
too
for
funny.
sharing your insight again and helping me out with this episode. I always appreciate you. Thank you, friend.
Yeah, you're welcome. And I have as a friend, I have a kind of a behind the scenes view of what's coming up, and you all are going to be amazed. So keep tuning in,
Oh,
keep listening.
thank you.
If you're not a patron, join the patron only episodes. She doesn't invite me to the Zoom sessions, they'd be much more fun. But She
Do you want to come to one of the Zoom sessions? I'm going to plan one for after the holidays.
Okay, sure. I'll definitely come.
Okay.
Yeah.
You're like an
But yes,
honorary
please join.
patron.
Yeah, I am. I am. Please join. Please listen in. Tune in. There are some really cool things coming up, some really cool podcasts and things in the works, you all. So,
Thank
and I'm
you.
very proud of you, Erica, for all of your hard work and all of your advocacy for nursing. You inspire me. You say the things that I can't say.
I think you say plenty. Until next time on the next Nurses Uncorked.